Hello everyone. So I hope you are all doing fine. In this video discussion class, I will be covering about the evacuated tubes. So this discussion is very important not only in your PMLS2 class but also sa inyong second year ng mga majors or third year, of course sa board exam. Dili gyud ni mawala. Even just sa recent na board examination, questions about evacuated tubes kay always yun na siya nagabalik-balik. So I want you to remember, I want you to listen attentively because if you fail to understand this one at this level pa lang, you will have a hard time yun no in understanding a more complex na mga concepts. Okay, so our objectives for this discussion is the first is we will be describing the color coding. Kung color lavender, ang sabang meaning ana. Kung color red, kung color yellow, ang sabang meaning ana. And then other than that, we'll be identifying what are the tests. Okay, we will be identifying what are the tests on the applicable ang color sa atong evacuated tubes. The next one is we will explain the order of draw. So dili lang na siya ibig sabihin class kung unsa imuhang una nakuha na color, mo na pud na siya imuhang gamiton or una butngan og sample. So you need to follow certain order of draw. So we will be explaining later on what is the rationale, why we need to follow the order of draw. And then explain the additive contamination and the specimen rejections. So now let's proceed with the characteristics of our evacuated tubes. So we can use this one both sa to ang syringe method as well as on our evacuated tube system. Okay, and it comes in various sizes and volumes. So, kining naa sa screen, this one mo ni siya ang the usual size no nga naa mo in your laboratory or inyong ginadala-dala sa inyong lab classes. But we also have the longer ones and we have here our bottle. So, I know wala pa sa inyo no ang nakakita aning bottle, but we will be covering that one later on. And then, it is sterile, okay? In order to avoid contamination, it contains expiration date on the label. So, I believe you already know how to read the expiration dates on your evacuated tubes. And then, it can be made of glass or made of plastic. And it can fill automatically with blood because there is vacuum that is present inside. That is why class other term for evacuated tube is vacutainer. Okay, so the vacuum that is present inside our evacuated tube, that is a negative pressure. And then the amount of vacuum is equivalent to the amount of blood or the blood requirement of our evacuated tube. For example, our lavender top, the usual blood requirement is 2 ml. Therefore, the amount of vacuum that is inside is 2 ml. So, mas ma-appreciate nato ni class atong evacuated tube system no wherein the vacuum is very important during blood extraction. Okay, and then the next one is we have our additive tubes. So the additive tubes, these are the tubes that contains or naa siya yung mga kuan sa sulod no, naa siya liquid inside. So that is our additives. So the purpose of this additive class is to prevent, to enhance, or to activate the clotting mechanism of our blood sample depending on the need no sa ato ang test. It preserves blood component as well. So other than the clotting mechanism. So that is why I know some of you gipang tago gyud no, gipang tago gyud ninyo ang inyong first blood na na-extract sa laboratory na try to observe it if you placed it inside an additive tube. So, even if nahuman na ta with our PMLS2, try to check the if ang inyong sample or blood sample is still at its liquid state. Eh, di ba normally, the normal process na ma-undergo sa ato ang blood once it will be removed in the body is that it will undergo clotting or coagulation or sana, ng magbilog-bilog ba ito ang ginamin, no? Okay. So, if the tube contains additives, it requires proper inversion or mixing. So, I know in your laboratories na demo na ni siya no on how proper inversion is properly done. Okay. And we need to follow certain volume. For example, ato ang light blue, the volume requirement is 1.8 ml. The reason for that, nganong kinahanglan nato na i-follow na amount is the blood to additive ratio. Ang kaya lang i-preserve sa additive that is present inside our light blue is 1.8 ml. So if magsobra or magkulang on that level, of course, it will not be acceptable for testing. Okay, the next one is our non-additive tubes. So wala siya additive present inside. Example for this is our red or our gold top. Okay, try to check your evacuated tubes class. And for the expiration date, not only the additive ang ma-expire, but also ang ma-expire is the vacuum that is present inside. And it must be stored between 4 to 25 degrees Celsius for us to avoid ng ma-distort ang ato ang evacuated tube, especially sa ato ang plastic. Okay, ato ang plastic na tubes, it can be easily softened or distorted once exposed to excessive heat. Okay, so now let us compare the sample that we can extract based on the type of evacuated tube na to ang gamiton. So, plasma and our serum. So, for our plasma class, this is a sample for if gibutang na to siya on our evacuated tube with additive present. But for the serum, this one is placed on without the additive present inside. Okay, without. So, since wala man siya additive present inside, therefore, ang dugo na to, it will undergo its normal process which is clotting. While, on the other hand, our plasma, dili siya mag-clot, it's because natay additive present. I-prevent ang clotting, that is why the sample will still retain its liquid state. Okay, therefore, ang atuang plasma, this is the liquid portion of our anticoagulated blood or wala nag-clot. Ang atuang serum naman, this is the liquid portion of our coagulated blood or clotted blood. Okay, so another differences class or sa ato ang serum and plasma, it's the presence of our clotting factors. Okay, asa man present si clotting factors ma. So, it's present on our plasma. Okay. Naadri clotting, CF is for our clotting factors. Ma'am, anong naadri man si plasma ang naay clotting factors, ma'am? It's because wala siya nag-undergo og clotting, therefore wala nagamit ang clotting factors. Ang clotting factors na alang diri sa liquid portion sa blood, nagdutaw-lutaw. As to our serum naman, wala siya clotting factors present inside. It's because class, si clotting factors is na-consume na on our red cells. Okay, na-consume na siya on the clotting. Okay, so again, clotting factors is only present on our plasma. It's because wala man nag-undergo og clotting or coagulation. Therefore, wala na consume. As to our serum, there is no clotting factors present on the liquid portion. It's because it was already consumed on the clotting process. So I hope that one is clear. Okay, so now let's proceed with the different specific characteristics of our evacuated tube. So we have here our yellow top. So lahi ni siya color gyud sa inyong gold top ha, kana inyong ginadala-dala sa inyong lab, that is the gold top, not the yellow top. So if ma-confuse mo, just check on the label. Pag naamoy makita na acid citrate dextrose, so it means that is a yellow top. So this is wala kayo siya ginagamit or di kayo ninyo makitaan sa laboratory. It's because classes, this is usually for kanang mga special na testing. So, HLA phenotyping, that is our human leukocyte antigen. This is for determining paternity evaluation. So, kining mga DNA testing, no? And other than that, it's for transplant compatibility. So, di ba, before transplantation, organ transplantation, di ba, i-check sa if compatible ba ni kay patient or not. Okay, so Going back to the anticoagulant present. So actually, this is a combination of two anticoagulants, our acid citrate and our dextrose. Si acid citrate class, ang iyang mode of action is to prevent coagulation. Paano man i-prevent ang coagulation ni acid citrate? By binding sa calcium. Take note class, calcium that is one of the main element that is needed in order for the blood to clot, to undergo clotting or coagulation process. Therefore, pag gibind na ni acid citrate si calcium, wala na yung magamit for the clotting process. Therefore, it will not undergo coagulation. Okay, the next one is our dextrose. So it will maintain RBC viability through providing nutrients on our RBC. Okay, the next one is still yellow type ni siya class, but this one is a bottle. This is our blood culture bottle. That is the name of this. This is not an evacuated tube, but this is really a blood culture bottle. So from the name itself, blood culture bottle, of course, this is for blood culture purposes only. And this is under our microbiology section in the laboratory. So the anticoagulant present kining black na portion at the bottom class, this is our sodium polyanethol sulfonate or our SPS. So this one plus the mode of action of our SPS, it will allow the bacteria to grow so that they can be cultured. Okay, so favorable ang environment sa bacteria inside our blood culture bottle. Therefore, mas it can grow if ever na ay bacteria na present. This is usually done or requested by the doctor class to check if naabay bacteria or presence of bacteria on the bloodstream. That condition is called sepsis. Okay. And the blood requirement for this one class is mas dako, no? For our pediatric patients, usually it's 10 ml. For our adult patients, usually 20 ml ang blood requirement per bottle. And the difference lang class for the manner of collection for our blood culture bottle is that we cannot use our alcohol. And we cannot use the alcohol to clean the puncture site, but we are going to use our providone, iodine, or our betadine to clean the site. Okay. Okay, so just to give you an idea, class, kung ginaunsa ba nato ang blood culture bottle right after blood extraction. Since we are the one who extracted the blood sample, therefore, kita pod ang mo-feed sa machine. So, this is an example of the machine, no, nga blood culture bottle reader. Okay, so, i-barcode lang nato na siya, automatic on the screen. It will appear kung asa nato na area ibutang. Sorry, after that, let's just wait for how many days kung mag-positive ba or negative. Usually, ang reporting ani class is after 5 days pa. Okay, but on that part, on checking if it's positive or negative, it's not the task of the phlebotomist anymore. It's the medtech na on the microbiome na area sa lab. Okay, the next one is our red top. So as I've mentioned earlier, there is no anticoagulant present. But we have two different types of red top class. We have the plastic and we have the glass one. So the glass one class, the ones that you have there is, as you can see, there is no, it's clear inside, no, wala siya yung mga liquid portion. It's because wala siya additive present. And for the plastic naman, if you can see a plastic na red top, nga basig matingala mo, ma'am, naalagi na siya yung murag sulod-sulod na something, ma'am. So that is not an additive, that is a particles, specifically silica. Okay, silica, S-I-L-I-C-A, silica particles inside our red top. Okay, it's because the reason for that nga nung naa siya silica particles in order for the blood to clot. Ma'am, nga nung sa glass top, wala man siya silica particles. It's because class, on our glass, the glass, natural characteristic of the glass is it serves as the clot activator. Okay, once ang blood madikit sa glass, mag-start na dayon siya with the clotting process. Okay? Again, on the plastic, the present is silica particles. And then sa glass, wala siya sa silica particles. It's because the glass itself is the clot activator. Okay. So, this is usually used class sa mga chemistry na test. Kanang mga fasting na test, fasting blood sugar, cholesterol, lipid profile, our creatinine. So, those tests, kana siya. It's under, or we will be using our red top. Okay, next is the gold top. So, I already drew this one, no, on the board before. If you can recall. Ma'am, I thought wala siya anticoagulant present pero unsa ning nakasettle at the bottom. So that is our gel. Specifically our thixotropic gel. Okay, so kindly look the spelling on that no sa inyong book na lang na siya sa inyong references. So kining gold top class, other term for this one is serum separator tube. As what I have mentioned before, after centrifugation, ang gel, it will be in between or barrier ni siya sa ato ang serum and our red cells. Okay? So, the same lang yun sila og function with our red top. It's just that it contains gel inside. The next one is our light blue. So, the anticoagulant present is sodium citrate. And the mode of action is it chelates calcium, or when we say chelates calcium plus, it will bind to the calcium in order for the calcium to be removed. Therefore, our blood will not undergo clotting process due to the absence of calcium. So, tanan na coagulation studies class, automatic light blue. So, wala na tayo other option. It's only our light blue. Again, coagulation studies. Kindly check on the test. Unsa ba ang mga test under coagulation studies? So, example that we have here, we have our ProTime, PT ProTime, APTT, activated partial thromboplastin time. We have fibrinogen, we have our D-dimer. Okay, so our black top naman, it contains buffered sodium citrate, the same siya mode of action. But this one is only specific for our estimated sedimentation rate. So, kana lang yun, basta mauni ang test, estimated sedimentation rate, automatic sa black top na siya ibutang. The next one class is our green top. Okay, so for our green top naman, sorry, it contains sodium or lithium heparin. So actually, we have three different forms of heparin. Other than the sodium and the lithium, we also have the ammonium. Okay, so how are you going to choose, ma'am, if unsa ba ang better na heparin? So if you're going to use it for immunology na mga purposes, so sodium heparin ang dapat gamiton. For chemistry naman, it's a lithium heparin. And then the ammonium heparin, mo to siya ang present na heparin on our capillary tubes. Okay, so the mode of action of this heparin class is to inactivate the thrombin in order to prevent clot formation. Ma'am, unsa man ining thrombin, ma'am? So, thrombin classes is a form of enzyme. Ang function ni enzyme or ni thrombin is it will convert fibrinogen to fibrin. So, once na-convert na siya into fibrin, it means mag-start na siya og clotting process. So, therefore, pag i-inactivate siya ni heparin, ang thrombin, dili ta maka-proceed with the clotting process. Okay? So, test, chemistry, basta ammonia class, automatic, it will be placed in our green tab. And it is ideal for stat request. It's because class, just to give you an idea, no, sa to ang setup sa laboratory. After blood extraction, you will wait for 15 to 20 minutes na stand imong sample before ka mag-centrifuge. You are not allowed to centrifuge immediately because it can lead to hemolysis. Okay? After 15 to 20 minutes, that is the time where you can proceed with the centrifugation. But when you're going to use green top class, no need ang waiting time. You can proceed with centrifugation right away. That is why it is ideal for stat request. The next one is our light green top. If ang ato ang gold class, siya ang serum separator tube, si light green naman ang plasma separator tube. Okay, so the same lang siya with the green top, it's just that na siya thixotropic gel. Ana, it serves as a barrier between the plasma and the red cell. Okay, the next one is our lavender top. So the anticoagulant present is our ethylene diamine tetraacetic acid, okay, or our EDTA. So the mode of action of this one is it chelates calcium. You already know this one. And naapod tay two different types no of our lavender top, natay plastic, naapod tay glass. For our plastic glass, the present na EDTA is our dipotassium EDTA. While on our glass, it's tripotassium EDTA. So usually sa inyo kay naka-glass man no. So if you can observe, it is in liquid form. But for the plastic glass, it is spray dried. Okay, wala siyang particles inside. It's not in liquid form. Again, plastic, dipotassium EDTA, and spray dried. And for the glass, tripotassium EDTA, or it is in liquid form. Okay? So, it is ideal for our complete blood count or sa test na to sa hematology. It's because it is ang iyang anticoagulant is able to preserve the blood cell morphology, di ba? That is the pinaka-importante na ginatanaw na to sa hematology. And it inhibits platelet aggregation. So, it's very helpful no in our hematology tests. And then we have our gray top. So, it contains potassium oxalate. So, the mode of action of potassium oxalate is it will chelate calcium. Another one class, it contains sodium fluoride. So, the function of sodium fluoride is to inhibit glycolysis. So going back sa inyong anatomy, glycolysis o sa manang end product sa glycolysis na process. Sorry. So it's glucose. So it will inhibit glucose, therefore ang imuhang ma-measure gyud kay ang actual glucose level ni pasyente. So that is why it is ideal for glucose testing. Other than that, lactate testing and our blood alcohol levels as well. So, ito siya ang pinaka-common na ginagamit nato sa laboratory. The next kini nga table is our uncommon na mga evacuated tubes. So kindly, ano na lang no, it's very easy na lang man to understand. So just to add up lang information na wala dali sa table. So the evacuated tube that is helpful in HIV testing is our white top. Okay, and then if green top ato ang top 1 no for stat request, ang ato ang top 2 naman is the orange top. It's because instead of 15 to 20 minutes na standby na waiting time, mas shorter siya sa orange top. 5 to 10 minutes na lang na standby or kanang optimum clotting time before centrifugation. Okay? So, the next one class is kining let's just focus on this side, the number of inversions. So each tube na siya requirement na number of inversions. So we have picture here class na kana demonstrate no og how a proper inversion is performed. Okay? So after that one, we just have to follow to memorize pila ba ang required na number of inversions um per color sa ato ang evacuated tube. Failure to follow proper inversions, of course, it can lead to hemolysis. Okay, so the next one, very important ni siya class, order of draw. This is mandated by the CLSI. So this is what we are going to follow, no? Kung unsa ba na color sa tube imong una na butngan. Okay, so the purpose of that one is to prevent contamination of blood specimen by carryover of additives. So it's because since we are opening our evacuated tube, ang tip sa ato ang syringe dikit sa mouth sa atong evacuated tube, therefore nagyud siya exposure. So there are some additives na that can interfere some of the results. So gi-arrange na siya based on kung unsa ba ang naipinakadako na impact on the sample. Okay, so other than that, tissue thromboplastin can affect some coagulation test. So sunod yun si ano no, after our yellow or our kining sa ato ang blood culture, ni sunod dayon ang ato ang light blue for coagulation. It's because very sensitive. Dapat unahon gud ang naay coagulation process na requirement. Okay? And then we just have to memorize this one. Okay? So memorize yun. If you can think of a much wittier or much easier na mnemonic, so much better. But mo ni siya ang gi-recommend sa CLSI. So napod ni siya sa inyo ang mga references. Okay. So let's have a practice, no, sample problem on unsa ba paano ni siya ma-apply ang order of draw. Okay, so for example, si patient, ang iyang request na siya CBC, na siya protein, na siya cholesterol, na siya blood culture, na po siya ammonia. Okay, the second thing that we are going to do, class, is of course, we must identify if asa na siya ibutang na evacuated tube. That is why it's very important to revisit, no, our prelim topics on the sections in the laboratory. Ana, katong mga hematology, naka-list down na dito unsa ang mga test. Okay? Kabalo ka sa order of draw pero wala man kabalo asa day siya ibutang properly. So wala lang gihapon. Okay? So i-memorize unsa ni siya ng mga test para asa ni siya. Therefore, diri na ko siya ibutang na evacuated tube. So for our CBC class, it must be placed sa atuang lavender. Okay. So i-place siya sa lavender na color. Okay, ang atong protein, since this is a coagulation test, so sa light blue. Cholesterol, this is a chemistry test, red or gold top. Blood culture, sa to ang bottle or yellow. And then ammonia, as I have mentioned earlier, automatic green top. So, by following our proper order of draw, ang una ni mubutngan og dugo kay ang ato ang blood culture. And then next is our coagulation, which is the light blue. And then, napay nabili na dugo sa imuhang evacuate sa imuhang syringe, sunod butngan nimo ang atoang cholesterol or our red or gold top. After that is the green top for ammonia, then ang last na nimo nabutngan is the lavender top for CBC test. Okay, so that is how you're going to decide on what tubes or what is the order of draw that you're going to follow. It doesn't mean, class, na dapat present yun ning tanan na mga color for you to follow the order of draw. Okay lang yun na lakang-lakang. Okay, as long as proper gihapon ang imong order of draw. Okay, so kindly study, read your references, no, para napag mo better na understanding about this topic. So that's it for our evacuated tubes. I hope you learned something today, especially kini siya na topic, daghan kaayo siya mga sa mga new terms sa inyo ha. Daghan mo i-memorize in this topic. So that's it, and thank you everyone.